Okay,
Okay,
good
so
morning,
we're
everyone.
live now, Natalie, is that right?
I think we're live, right?
Yes.
Okay, great. Well, thank you everyone for joining. We're very excited to have Dr. Spiro Theodorou moderating this panel in New York City, and I'm Dr. Erez Dayan speaking about hands-free body contouring. This is technology that I'm particularly excited about, and I'll tell you why. Because it's really a three-in-one device, which has never really been done before, especially in a hands-free manner. So please feel free to ask questions. I'm sure Dr. Theodorou will have some questions as well, and we can kind of go through the presentation like that. These are my disclosures. I always, like to give a little bit of background about how I got involved in this technology as a young plastic surgeon. And when I was training at the Harvard program, we had a lot of visiting lecturers, for grand rounds. And usually these were people with a very strong reconstructive background, like, Laurent Lantieri with a face transplant in France, or people doing conjoined twin surgery. But we had on one occasion the treat of having Dr. Theodorou here in the center and Dr. Chia come give us a lecture. And this was really transformational for my career, because they came and they spoke about their use of minimally invasive technology and how they did it all under local anesthesia. And it really changed the way I looked at plastic surgery in our patient population. Now, these are, we can always look at statistics and they're useful, but the reality is we already know, even forget about being providers, we already know what people want. People want minimal downtime, they want a result, and they want less invasive procedures. And the statistics are very consistent with that. If you look at excisional procedures over the past 20 years or so, they're up about 100%. But if you look at non-invasive and minimally invasive procedures, they're up 6 times that. And as a matter of fact, the body contouring sector is the largest growing group in aesthetics in terms of non-invasives. So this is really where our patients are really focused on. And this is, Dr. Theodorou's analogy, which I think is very accurate. When you go to the Apple store, you're not asking for the iPhone 6, you want the iPhone 11. Patients are the same way. And, I think the landscape has changed a lot as a plastic surgeon. Classically, the older plastic surgeons, more experienced plastic surgeons, would depend a lot on word of mouth, direct referrals. But things are rapidly evolving. Social media has played a huge role. And patients are really doing a lot of their own homework and finding their own clinicians, and they're doing that based on their fluidity with technology and results. And I think those are kind of the key things for us. So this is our office here in Northern Nevada, and I joke around, when we first acquired a lot of these devices, I used to lock them up in a closet and to kind of keep them away and keep them safe. But what I realized was leaving them out actually is the best thing you can do, because when patients come in, it sends a message, and the message is that you're an advanced practice, that you have an array of options available. It's not just one device that you're going to try to apply to all patients. And that you're really using the latest technology, and the devices look sleek. Patients ask about them. Some patients come in and they said, I know you have a lot of technology. I just want a tour just to see what there is and what the options are. They don't even necessarily know what they want. Now, patient selection is really critical, and I think it's something we should spend some time discussing. We have basically 3 groups of patients. We have the young group, the middle group, and the older group. And the young group, they come in all the time for things like Botox and filler and skincare. Frankly, they don't really even need to come in. They look fine most of the time. And then in the older end of the spectrum, these patients typically need either a combination procedure or just an excisional procedure. The middle group is really where we are focused. And this is what we define as the treatment gap. And what this is, we can all imagine our patients in their 30s, 40s, 50s, who have some skin laxity, but they're not really candidates for like a liposuction because their skin won't tighten afterwards reliably. But they're also doing an traditional excisional procedure is overkill for a lot of these patients. So these are the patients that are kind of in the middle ground. And this is a great paper by Theodorou, Chia, and Del Vecchio, really defining the treatment gap. And these patients come from kind of different areas. So there's younger patients that just don't don't fit the mold for an excisional procedure. They're not bad enough for an excisional procedure. They're not kind of quote unquote good enough for liposuction because you don't know how their skin may contract. Then there are patients that are willing to accept less of a result, a modest result, but really don't want to go under general anesthesia or have any kind of incisions. And then there's a large group of patients that have had surgery, but really have a problem, which is recurrent laxity. Just because you had a big operation doesn't always mean your result is satisfactory. So a lot of patients after body contouring or after face lifting, they'll have recurrent laxity. And it's a challenging thing for plastic surgeons to figure out. Are you going to take them back to the operating room or revise them? So the non-invasive technology really has a great role in all of these groups. And if you ask me why we have the treatment gap, this is data from the Pew Institute. I think it's pretty simple, actually. I think more than ever, more and more people are on social media. They are comparing themselves. They're even, it's unbelievable. Even people that are you would never see in a bathing suit normally, or posting pictures of themselves in bathing suits. These are people of our parents' generation. So we're constantly on social media, and I think this is a big part of why the non-invasive technology has become so popular, because people are really seeking it. So if you look at non-invasive body contouring devices, there were 31 devices released between 2012 and 2018, and the largest number of devices actually were released in 2016. And the indications are rapidly expanding, and this is really this is a response to the consumer demand. Here you can just see graphically the market share by year. 2016 was a spike, and the indications are growing. So now there's indications for skin resurfacing, cellulite, acne. So the indications continue to grow, and actually the adverse events for most of these devices are quite safe. The most common adverse event across the board are acute skin blistering or discoloration. Now, despite how large the minimally invasive body contouring and non-invasive body contouring space is, there's a tremendous amount that we don't know and that we're actively researching. And cryolipolysis was kind of the big player in this industry with cool sculpting for a long time. And that's partially because they were really the only technology that offered a non-invasive body contouring solution. But really, it's unclear whether cold is better than heat, whether muscle is more important than fat. So there's a lot of things that are being sorted out scientifically to really give a good scientific explanation for what's going to work in the long term. So these are the current technologies in non-invasive body contouring. We have radiofrequency, we have EMS, and we have cryolipolysis. High frequency ultrasound and laser have kind of fallen out of favor. This is the largest growing area in the aesthetic industry, which is body contouring, non-invasive body contouring. So one thing we have to identify is who is our patient population. And this is important because a lot of the industry assumes that our patients are kind of the ones on the left here. And these are all kind of model figures, maybe with slight problem areas. But in reality, our patients are the ones on the right. These are patients that are coming in with all different types of aesthetic concerns, all different shapes and sizes, all kinds of concepts of what their goals are in terms of aesthetic appearance. So we really need solutions that we can customize to this population. So, to make an analogy here, if you like pizza, first of all, the history of pizza is interesting because the history of pizza started off in Naples in the 18th century, and it really progressed where tomato sauce was first added, and then finally the Romans started including toppings and cheese. So pizza started off as a flat bread, and they were made into boons, and it was kind of just a plain flat bread. And eventually these components were being added: tomato sauce, the toppings, cheese. And today, if you went into a pizza place and they gave you a menu that looked like this, you'd probably be upset. You would say, well, they tell you, $8 for the bread, $6 for the pepperoni. And by the time you ended up getting your pizza, you would not have only been upset that you spent a lot of money, but also a lot of time. And the aesthetic patient is very comparable to the pizza pie. We have skin, fat, and muscle. It's basically the components of soft tissue. And each patient is different in this regard. Now, when I was starting practice, I knew technology was important. I knew that as a younger plastic surgeon, I needed to incorporate technology to be competitive because I can't depend on my experience alone. And I felt like this, these, that show, I think it's on Discovery Channel where they're, fishing for Alaskan crabs, and it's, the dangerous waters. And you also have a limited budget. So, it's a very, whatever that decision is, whichever device you choose to get is a critical one because it's an expensive device and you want to make sure that you can really use it and get results. So these are just, some of the more popular devices on the market. And the issue is a lot of these devices only focus on a singular component of that pizza pie, muscle, skin, or fat. And if you buy one of those devices and it's the only one you have, you're very likely to treat everybody like a nail. This device is the hammer and everybody's the nail. And I think that's where things you can get into trouble. So if you have a cool sculpting device, for example, and you have a patient, which happens very commonly with some excess fat, but also excess skin, cool sculpting device may remove some fat, but it'll actually make the skin laxity problem, it certainly won't make it better. It may make it worse because now you deflated the soft tissue envelope. So it's a problem if you try to apply that one device to a patient that doesn't quite fit the mold. Same thing with M-Sculpt. Let's say M-Sculpt is effective in stimulating muscle, but the patient has a significant amount of fat that they could benefit from a reduction on, as well as skin laxity. This device is gonna fall short in that patient. So if you had to dream of the ideal aesthetic device, what would it be? And to me, it would be hands-free so that I don't have to have an employee or a nurse, an esthetician even, using the device manually. It would obviously, safety is a baseline. Efficacy also is a baseline. If you gave me a device for free that didn't work well, I wouldn't want it because it actually has a negative impact on your reputation. And if you take money from patients, you have to deliver value. And it would be able to be applied to multiple components of a patient. So if a patient comes in with skin laxity, I could deal with it. With excess fat, I can treat them. When they want to, strengthen their muscles, I'd have that ability all in one device. And ideally, it would be synergistic, where if I did 2 of these treatments on an individual patient, they would not only be additive, but synergistically work to be more than their additive effect. And then, disposable cost is very important because it affects how you treat the patients. If you do 3 treatments on a patient and they're a little bit upset, and your disposable cost is $800, it's going to affect whether or not you give the patient the 4th treatment, and that's going to affect how happy they are. So having a 0 to low disposable cost, I think, is really critical. So the aesthetic patient comes in all shapes and sizes, and we have to be able to customize the treatment to these patients. So the Evolve by InMode is an extremely exciting device because it really hits a lot of those, pretty much all of those markers that I listed on the ideal device. It takes care of all components of the patient, of the aesthetic patient, in a very customizable way. So it can tighten skin using bipolar radiofrequency, reduces fat with another module, and I'll describe all these individually. And it also stimulates muscle with no disposable cost and, as I mentioned, really customizable approach. So what is radiofrequency? We should go back and just look at the science for a second. Radiofrequency essentially is an electromagnetic current that travels through tissue. And when you apply it to tissue, different tissue types have different resistance or impedance. So fat, collagen have higher resistance and they generate more heat selectively. And the nice thing about radiofrequency is it's colorblind. It's not like a laser that's targeting melanin or a specific chromophore in your skin. It's non-specific. So we can apply this to African American patients, Asian patients, really it's really colorblind. You can apply it to any Fitzpatrick type. So it selectively is heating these tissues and over time is causing neoangiogenesis, new collagen formation, and fat reduction as well. And this is an example of some of the minimally invasive technology, just showing the power of radiofrequency in contracting tissue up to 30–40%. This is an example of a result using a non-invasive, so there's no incision, there's no needle stick made, demonstrating how bipolar radiofrequency can really remodel the soft tissue. And in a patient like this, frankly, short of an excisional procedure like a neck lift, I don't know what other solution there is. So this is really transforming how we treat the aesthetic patient. Now, Spiro may say, you know, you don't play bocce ball, but I'm going to show you this anyway. I think the success of InMode really relies on control. And radio frequency is all about control. You need to be able to reach target temperature and not exceed it so that you don't have any burns, but you also stay effective. And so this is where InMode really shines, because they have very close temperature controls and impedance controls that are preset, and the machine attains those temperatures, extends them throughout the treatment, so you get an effective treatment that's safe. And I think that's really key. Now, this is something we're looking at actively scientifically. Temperature and treating soft tissue with thermal energy has been done in many different ways. You have high frequency ultrasound, you have radio frequency, lasers, and they all basically work by applying a thermal energy. Now, the thing is, it's not all about temperature. It's a combination of temperature and time. And this is an Arrhenius equation where the white line here is soft tissue contraction. And basically, you can either apply high temperature for a shorter period of time or lower temperature for a longer period of time and get a similar soft tissue contraction. And what's interesting is if you look at some of the science behind this, if you have a lower temperature for a longer period of time, you get a more effective collagen stimulation than a high temperature to shorter period of time. And in addition, it's safer. So this is really a part of one of the modules, which I'll discuss, is the Evolve Tight. Really takes advantage of this, where you're heating the tissue consistently for a longer period of time and allowing for a more effective contraction than some of the more invasive technologies even that heat tissue for at a higher temperature for a shorter period of time. So we have skin tightening, fat reduction, and muscle stimulation, and these are our different patient types. Now, if you look at the fat reduction component, it's really exciting because we have 4 applicators, and as you can see here, they're customizable. And this is important because patients come in for all different aesthetic concerns. You know, I have a patient, she actually was Miss Nevada, Nisaya Mancini. She was competing for Miss America this past December. And she came in and she said, you know, my left upper arm is just a little fuller than the right, and it's always bothered me. And so with this device, you can customize it. You can apply it to the area that the patient is concerned about. And here you can see on the underside of the device, there's these little holes that apply vacuum suction. And vacuum suction actually changes tissue impedance and allows deeper penetration of radio frequency. And here you have between these 2 electrodes bipolar radio frequency, which are applying thermal energy to the tissue and actually causing the fat cells to die through electroporation, which we are scientifically actually seeing on different kind of microscopy imaging, where you're basically putting holes in the cell membrane and causing them to die in a very controlled fashion. And here you can see some basic histology showing that when you heat the adipose tissue, you're actually increasing penetration of the radio frequency and killing the adipocytes. Now, one important thing about this technology is the heat profile after treatment. You know, the goal is to volumetrically heat tissue. You don't want to just flash burn it. You want to volumetrically and gradually heat it so that over time that heat stays there, because that's really what's going to cause your results. So here you can see near-infrared thermal imaging demonstrating that after treatment, you still have a thermal signature, and that's really positive. This is just 15 minutes post-treatment, and you can see the thermal signature here, which really supports how well this device volumetrically heats the tissue. This is the skin tightening module. So there are 8 applicators. This is the Evolve Tight, and it works through bipolar radio frequency. So there's a positive electrode centrally and negative electrodes on the external surface here. So the energy is moving between the central to exterior electrodes, and there's temperature monitors in between. So you're really closely monitoring exactly the temperature that you're at, and you set the device beforehand. Here you can see the application, so you're connecting each individual applicator, and again, this is totally customizable, so you can put it on lower extremity and abdomen, you can put it on both upper extremities. You have 8 applicators, so it's really very easy to move it around different areas of the body. And here you can see the interface. So you have all your applicators, and it's all color-coded, and what happens is you set your cutoff temperature, usually it's 42, 43 degrees. You set the power basically dictates how quickly you're going to get to that temperature. And then here Here you can see the amount of time your treatment is and how long you want it to be. And it's all color coded, so it reaches target temperature in about 2 to 3 minutes. And once you're in the temperature range, it keeps it there, and it knows it's actually an amazingly smart device. It knows exactly to the degree when the temperature is changing, when it needs to apply energy, and to which electrode. So here you can see just in a schematic, the energy is moving from the central electrode to the outer electrodes and really causing a non-ablative energy to the dermis, to the subdermal space, as well as the subdermal adipose tissue. And on histology, you see the collagen reorganization, collagen growth, and elastin reorganization as well. And we're actually looking at, through the universities, some of the most sophisticated microscopy to demonstrate this, in the most high resolution way possible. And here you can see again how it can be applied to different places. So patients really appreciate this because not all patients are the same, and we can't take a cookie cutter approach to them. It can't be, this is what I have, and this is what I'm going to do. So we can really customize our treatment to the patient, which really wasn't an option before. Now, muscle physiology. So we talked about fat reduction, we talked about skin tightening, and now we're talking about muscle. And muscle physiology, as we may remember from medical school, is actually pretty simple. We have, here you can see this is a motor unit, which is what makes up our muscles. We have a nerve, and we know through the sodium-potassium channels, they will stimulate the muscle fibers. And it's an all or none phenomenon. Either you stimulated the muscle or you didn't. Either you reached the action potential or you didn't. There's no middle ground. There's no deeper stimulation. There's no lesser stimulation. You either stimulated it or not. And what happens when you apply this energy is motor units get recruited. And when they get recruited, you actually allow for a greater muscle contraction. And to sustain a muscle contraction, the motor units are firing at different times. So they're staggering their contractility to maintain an overall contraction. So the question is, what really matters more? Is it fat? Is it muscle? Well, fat comprises about 1/4 of the human body, and muscle in terms of mass, and muscle in men is about 40% and females about 36%. So the concept of synergy is very important here because we have a device that does 3 different things. It does fat reduction, skin tightening, and muscle stimulation. And typically $1 plus $1 equals $2, but in this case, it's a multiple of that. So this is the first device to combine preheating through bipolar radio frequency and EMS synergistically. And I'll show you why there's a synergy here. So EMS, as we know, it basically causes the muscle to contract at a supramaximal level, which we can't achieve voluntarily. And there is some fat reduction, which has been shown with EMS, because through the endoplasmic reticulum, basically a hypermetabolic phase, you get higher volume free fatty acids in the blood, which I'll show you. But beyond that, the main value of EMS, if you look at the different EMS devices, is simply to contract the muscle in a supramaximal way. But the problem is that, it's like going to the gym, it has to be a constant thing. And then, there's no element of synergy with any of the EMS devices. It's just muscle contraction. Now, here you can see MRI data showing 3 things. So that the EMS does fat reduction to some extent. It obviously hypertrophies the muscle, and it also causes an improvement in rectus diastasis. Now, the concept of synergy is important because the patient doesn't know, okay, this was a 30% effectiveness of the EMS or 20% effectiveness of fat reduction. They just want to look better and they want to feel value. And that's the goal. So this device is going to synergistically take advantage of 2 of the modules to augment the result so the patient feels maximal value. Now, if you look at heat and muscle contraction, it's actually quite interesting that if you go into other fields, other areas, for example, professional athletes, rehabilitation, there's a plethora of literature looking at the value of preheating in muscle repair and in muscle growth. And, even if you look at areas that we're familiar with, like hot yoga, professional Olympians and professional athletes train in hot rooms to optimize their muscle growth, muscle contraction, and it allows actually for a faster recovery. So this concept of heat acclimation is very well known in other areas, but it hasn't really been applied in aesthetics until now, and body contouring until now. Now, heat injury also causes fat reduction. So if you heat tissue to 43 degrees Celsius for the treatment duration, you're going to have about 10% reduction in fat cells, and that's been shown, in human cells, in vitro, and also in numerous animal models. So EMS also synergistically reduces fat. The impact of EMS on fat is through an extreme metabolic reaction, and this is data showing, in different models that you have where they stain for apoptotic nuclei in the fat cells and pro-apoptotic markers, that EMS alone actually also reduces fat. So what we're talking about is synergistically combining radiofrequency thermal energy with EMS to augment the overall patient result and outcome. So here you can see demonstrating free fatty acids after intervention, where you have increased free fatty acids that are a result of the cell death. And also, there's an acidosis associated with the muscle stimulation, which demonstrates that the muscles are being stimulated at a supramaximal element of contraction. So in summary here, RF and EMS combination optimizes muscle stimulation and overall patient result, and it synergistically reduces fat. And this is really the first device to do that, so I find it to be very exciting. Now, the EMS applicators, there are 4 of them. This is what they look like. I can tell you we've treated many patients with it, and we've treated patients who are professional athletes, jiu-jitsu instructors. It goes up to an intensity of 50. Most patients can tolerate around a 20. Even the professional athletes can't even approach a 30. So it's quite a powerful device. It works in a biphasic fashion, and you can really see the muscle stimulating from the external surface. Now, when we were looking at how to measure results, I think it's important to discuss this, because a lot of the non-invasive technology, unfortunately, I think the industry can be somewhat deceptive at times, and imagery is challenging. There's shadows, there's lighting, there's positioning, and if you really look at a lot of the technology and the results that they're showing, really look at it critically. Look at the shadows, look at the lighting, and to us, it was really important when we were doing these trials to deliver a very objective, consistent before and after photos to begin with. And what we decided to do, and this was largely under Spiro's leadership, look at the Quantificare camera, which is a research grade camera, and this is an image from it. And what this camera does, first of all, it provides you with a very consistent image. There's a consistent focal distance. You couldn't modify these images if you tried. But more than that even is it gives you a topographic map, and this is very important in body contouring. So if you took a cc of fat or filler and injected it, in a particular place on this patient's abdomen, before and after you take a photo, it's going to say there's an extra cc here, so it's quite sensitive. And these are results after 3 treatments here, and you can see this is to me, a near lipo result. I mean, 755 cc difference is significant over the treatment area. And the other thing we did was we took biopsies on all of these patients and looked at histology, looked at very advanced microscopy to really look at the fat layer, to look at the collagen and fibroblast, elements of the soft tissue, and really identify what's going on. Another result here of a patient, so you can see, these are significant results. And I'll say that I haven't had any patients thus far that have come back and didn't see a difference. And the beauty of this is you show them these images, it's pretty clear. This is not a squint test to see whether there was a result obtained or not. These are substantial results, and I think it really speaks to the science behind the technology, where we have lower heating for a longer period of time does actually cause a significant amount of soft tissue remodeling here. Another example. So I'm happy to take any questions. We can talk about the technology, talk about the studies and the results.
First of all, Erez, thank you for putting all this together. I have to say that I know Erez since he was a fellow at Mass General, and I can tell you that he's a lot smarter than I ever was. So having his head into this, and there's a reason why he's presenting all these things, because it's important that we have always a fresh outlook on things, and a lot of things that the new generation of young plastic surgeons can teach us that we unfortunately, as we get older, we tend to be a little more closed-minded. So I thank Erez for keeping me on my toes and always challenging me, and obviously the result of this study is part of that. So let's just
Well,
go over
thank you.
some questions, Erez. Could you go back to one of the slides showing a neck with, I believe it was
Yes.
face tight. I think there was a couple of questions regarding that because I believe somebody thought it wasn't.
This is actually
So,
non-invasive. Yeah, this is non-invasive. This is bipolar radiofrequency non-invasive.
right. This here, right here, this one here with Forma. So I
Hmm.
guess the question is obviously how many treatments and was there any neuromodulation um, that took place? That's sort of the question that was
Yeah,
asked.
that's a great question. So I'm glad you brought that up. So in our trial, using the Evoke device, which is the hands-free bipolar radiofrequency equivalent here in terms of remodeling the face, we did a treatment every 2 weeks for 3 treatments. Now, it's the point that I think is really important here is that you're right. You know, if you have significant platysmal bands and skin laxity, the platysmal bands are not going to be treated by radiofrequency. Now, this patient doesn't happen to have platysmal bands. You know, in order to really diagnose platysmal bands, you have to have the patient animate. Sometimes you can get fooled by the folds and skin laxity. But I think that point is very important because I learned that the hard way. You know, you have to look at the patient kind of comprehensively. And if a patient has significant platysmal bands, you either have to do something, a neuromodulator is an option, but it doesn't, you know, so skin tightening is one thing and platysmal bands are a separate thing. And I agree with you, non-invasive radiofrequency will only deal with the soft tissue remodeling, not the platysmal bands.
Would you say, Erez, I think it's important to point out as well that a lot of times patients might have platysma bands that you're not actually seeing at rest, and they're
Right.
covered by a thin layer of fat.
Yes.
And in the neck, you know, you can get, if you do enough of these, more than our recommended dosing, you might get a little fat loss in the neck doing this. So it's important to point these things out, not just for Evoke, but also for face tight or neck tight, that these bands might get exposed afterwards and they'll come back and say, well, I never had these bands. Now what? So it's
Well, you know,
critical
it's
that you
interesting.
pick up on that.
Yeah, it's interesting because
Either
if you look at
neuromodulate it
Mhm.
or perhaps even do an open neck lift if you're doing face tight or neck tight. Would you say that's, I mean, that's been
Yeah,
my experience, but
yeah, you know what's interesting about this actually. So if you look at face contouring, just as an example, you know, cryolipolysis has kind of been the major player or the only player in kind of hands-free face contouring for a long time. And the reason, and the thing is, it only dealt with fat. And what happens is over time, you know, people get excited because fat has been the enemy, partially because fat is the only target we have a weapon against. It has been, you know, for a long time, fat was the enemy and we've only had weapons against fat. So we focused a lot on fat. But what ended up happening, I think, and I see this a lot, is patients that have had these technologies, you know, Kybella, cryolipolysis, even liposuction, but the skin laxity was never treated, was never dealt with because they didn't have a good solution for it. So I agree. I think, you know, we have to look at all components and what that specific patient needs. And that's why I like the customization option of these devices because you can really titrate it, you know.
Erez, I got another question. When you use the infrared imaging, what temperatures were you getting on the treatment area with Evoke on an average?
Right. So it depends. It depends on what you set your target at. Normally for us it's 42, 43 degrees Celsius, and then it depends on how long after you're treating that patient. Now I happen to have some slides here at the end on Evoke, and I can show you actually Dr. Michael Kreindel, who developed this technology, actually did thermal imaging on himself for a full hour after the Evoke treatment and showed exactly what the thermal signature was, which I think was really, here it is. So this is actually 60 minutes, 30 minutes, 20 minutes. So you can see his cheek at baseline here all the way to 60 minutes. The heat signature is still there. So typically we like to treat patients optimally at about 42 degrees Celsius, 43 if they can tolerate it. And that heat signature will stay there for quite some time. So obviously the closer you treat to the end of treatment, the hotter it's going to be. But the point is that it's volumetrically heating.
I think, Erez, what is really important, everyone, to understand that not everyone's got the same sensitivity, right? So, yes, ideally, those are the temperatures that Erez said, but if you have a patient that comes in as a little sensitive, you can start off at 38, gradually get to 40 or 41, 42, and then again, then walk away. So it's important that it's not just, you don't have to start at 41 or 42. I know it sounds obvious, but there's many
Right.
patients have different tolerances. So, but the block heating component is extremely critical because that's what differentiates this machine from everything else out there. Block heating, uniform, down to depth of 4 millimeters is what the Evoke goes to, is critical to understand, because the fact that it's not operator dependent, standardizes a lot of the results and standardizes the treatment, which is important, because in the past, anything that required in motion devices, someone had to push too hard or push a little less. My best therapist is not here. My best esthetician is gone for the day. So all those variabilities go out the window. And I think that's what's really important, as Erez pointed out. Erez, I have another question for you regarding muscle contraction. If muscle contractions are all or nothing response, how can you have a supramaximal contraction?
Oh, that's a great point, actually. So it is an all or nothing response, but what
Go back to
happens
the
is,
muscle slide, if you don't mind.
yeah,
Erez.
I'm glad that question came up. So obviously, if you look at BTL Sculpt, which has been a major player in the EMS space, they talk about high frequency electromagnetic stimulation and how through magnets it goes deeper and penetrates deeper. And so how do you get a supramaximal contraction? Well, it's very important to understand muscle physiology, and supramaximal contraction basically means the repetition of the action potential is one factor. So the frequency of the action potential you're delivering is more than what you could do physiologically with sit-ups. So it's a factor of frequency. And then the intensity is another factor, not in terms of the on-off effect, but in terms of recruiting the surrounding muscle fibers and motor units to maintain that contraction. So that's why it's supramaximal means more than you can physiologically trigger that muscle to be.
Erez, you often hear, and I give kudos to the company that came up with this and introduced it into aesthetic medicine, because it was really a rehab modality.
Mm-hmm.
However, we've heard things like this is equivalent to 20,000 push-ups or sit-ups. Is that true? How does this compare? What is it? Is that a
To be
marketing?
honest, I don't really know what that means. I think, I hate to say this, and I don't want to point out anybody in particular, but if you look at the data, I think it's important when people are looking at this technology, look at the papers. And I think, one easy way to really figure out, is this real or not, is to look at the results and figure out what their outcomes we're looking at. Most of these studies from most of these other companies, and we discussed this in Spiro, I think, under his leadership as CMO, was very important to say in the beginning of looking at this technology, does it work or does it not? And what we want to do is find the most objective modalities to figure out, A, does it work? B, how well does it work? And how can we optimize it? And the reason I say that is because if you look at a lot of other technologies, look at the results, look at their papers and peer-reviewed papers, and look at the results. And a lot of that data is something along the lines of, we had 10 objective plastic surgeons evaluate the results, and they were able to identify the before and after. 75% of them were able to identify the before and after accurately. To me, that's not scientific. To me, yeah.
Erez, I don't want to interrupt you, but we have a lot of questions coming in.
Sure.
So just a simple answer, basically, is it possible to be equivalent of 20,000 sit-ups?
I don't know what that means. I think that's a marketing thing.
All right, let's go to the next question.
Okay.
From Dr. Ramuno. Notice a lot of my patients can only do about 13 or 14 with EMS. Anything to make it more comfortable?
Well, I agree. I think it's a powerful EMS, and I think it just has to be titrated to the patient. I mean, if that's what they can tolerate, that's kind of where they're at. The same way you wouldn't put them through a Olympic training program. I think you can gradually build it as they become stronger.
I think Rez and I, when we were doing this study, you had a jiu-jitsu patient.
Yeah, I remember her, Brazilian jiu-jitsu instructor. She couldn't handle more than 20. So I agree with you. It's powerful.
Right. Next question. The Quantificare picks are after tone. In other words,
right.
Are some with tone or some with? I mean, I could easily answer that, but is there tone involved in these pictures, or is it only evolve? Trim, or
right. So yeah. So the images I'm showing you here are tight and tone.
Yeah, I
actually.
believe some are
Some,
tight
at
and
least
some are
mine
firm.
are.
This
Some
one,
of yours maybe.
yeah,
Yeah.
it's a combination. I think our study involved both limbs. So
Hmm.
we had a couple patients. We had patients in one limb doing basically tight with tone, and we had another limb that was just doing tight. So you're
Right.
seeing
That's how we know the synergistic effect, because
right.
we have controls and then we have combination pictures as well. And it really depends on the patient.
Okay, next question, Erez. At what point does the patient begin to see results? By Dr. Alonso. In
Great
other words,
question.
what
So
do you
I would
tell
say if
them?
there's, yeah, if there is any downside to this, is that the results obviously are not immediate. Radio frequency takes 6-8 weeks, and actually, I think actually over even past that time, the result continues to show itself. So there is a waiting process here in terms of the radio frequency effect on the soft tissue does take about 2-3 months.
Okay, I have another question. If there's no results, perceptible results after 8 treatments with trim at max settings, what is the most likely explanation for that?
After how many treatments? 3 treatments?
8. 8 treatments.
Frankly, I haven't seen that. There's no question that it's not. So first of all, I think an important thing is making sure you properly identified the patient preoperatively. There's so many factors here. Is the patient, you have to weigh them beforehand. And again, this all comes down to a healthy lifestyle in addition. We cannot be the silver bullet for body contouring. This is, we talk to our patients about healthy, diet, nutrition, exercise, and then we help with this non-invasive technology. So it's tricky with body contouring because, if a patient goes outside and eats 3 cheeseburgers, it's not going to hold a candle against the most sophisticated device or liposuction.
I think, Rez, I think it's really important what you said. You got to weigh these specials before and after, and of course, the lifestyle changes. Do you have a slide that shows, I believe, all the different studies that were done with circumference? Would you mind pulling that up really quick,
Yeah.
showing like the different studies from different body contouring devices,
Oh,
showing
that slide's
circumference
not
change?
here. I know the slide you're talking about.
So the bottom line, I think, and that's important, is that all the studies that have been done have been about circumference studies. And
Right.
that's all, whether it's cool sculpting or sculpture. And on average, you're looking at a 4 to 6 centimeter difference in circumference with those studies, that from what I recall.
Right.
But the problem is that if you drink a bottle of vodka the night before and take a laxative, you'll probably, the next morning you'll have your circumference measured will probably be 3 to 4 centimeters less
Right.
for dehydration, et cetera. So having the quantificare, we don't have any association with quantificare, but I think it's critical for a patient like this, for example, that maybe some of the results are not perceptible, but at least you have something showing objectively. How does that work when they come in and they say, look, I don't see a result, but you have this kind of imaging. How would you handle a patient like that? I think it's a very good question.
Yeah, it's a
And those
great
go ahead.
question because I tell people it's like weight loss. This is going to be a gradual improvement, and I like the quantificare for that reason because circumferential measurements are kind of archaic. Even if you look in lymphedema and other areas, we don't use circumference is just not accurate. Depending on how tight you pull, where you are in the abdomen, it's just doesn't work. And as a matter of fact, if you look at some of the EMS studies. Even when they use imaging, MRI, they're not always taking the same cuts. So it doesn't mean anything if you're not at the same level. But I agree with you. I think having the imaging is key. If you show a patient like this, look, this objective camera showed you almost have an 800 cc loss across your abdomen. You can't, that's it is what it is. And most patients can perceive it. It's definitely not the norm most patients are actually thrilled and want to do more. The question is, the more you do, at what point does the results kind of level off? And we still haven't, most of our patients are done after 3-4 treatments.
So I have another question. Why is tone much more comfortable than body effects? I mean, body effects is basically a lot of the original electroporation technology that we used. But I think those are 2 separate technologies, right?
They're 2 separate technologies. First of all, they're completely different technologies. They both work with electroporation, but the frequency and magnitude of those high voltage waves are different. So they're truly the tone component, the trim component rather, is a more sophisticated technology and it's automated. So there's a lot of differences there. Even the vacuum technology is more sophisticated. There's a lot of components that are different.
Would you say the the discomfort that people seeing on EMS is a different type of discomfort regarding body effects, or how comfortable is EMS? And do some people complain about the tingling, or what is it that limits certain patients to go higher versus lower on the
Well, EMS, it's all about conditioning. If you're well conditioned and your muscles can handle a more intense contraction, then you can go up. I think the important thing with EMS is that you never max out the device. You never feel like you could have gone higher. So you have a high ceiling with the EMS power.
Okay, I have another question. We tried tone once, and how much contraction is needed? Is more better?
Well, the way we do it is we bring it up to the contraction where the patient is at their threshold of comfort. So you don't want them to be in pain, but you want the treatment to be effective. And they should feel some soreness after the treatment, as a result of the lactic acid buildup and supramaximal muscle contraction.
Here's another question, Erez, thank you. Can I use the different hand pieces in one session at the same time? In other words, EMS at the abdomen and RF on the legs, or do I have to have different sessions per function?
Good question. They do have to be in series, not in parallel. So typically what we'll do is we'll do the tight first, and then we'll do the EMS, so we take advantage of the preheating of the tissue.
Another question, are you any concerned, Erez, about rhabdomyolysis?
No, we haven't seen that. We actually measured pH levels and we looked at a bunch of different factors, and it hasn't been seen with this technology. I don't even think it's been seen with other non-invasive EMS devices, because you're contracting a relatively localized level of muscle groups for a relatively, as long as you keep it within the treatment parameters, you're not doing it for 2 hours, it should not be an issue.
So if you have a patient and I guess, would you do the RF or EMS first, or based on what the study you told us,
right,
what would the protocol be for ideal muscle, conditioning, and like you discussed?
Right. Well, ideally, you take advantage of preheating and heat acclimation, and I think that's really where this technology is awesome, because you're layering radio frequency heat on muscle stimulation, which is very synergistic.
I think it's important to point out that depending on the type of patient you have, so if you have a patient who's really thin but wants more muscle conditioning, you could preheat with tight, because tight doesn't go as deep, right? It goes to 4 millimeters.
Yeah.
And if you have a patient with a larger amount of adipose tissue between their skin and their muscles, you can start off with trim instead to preheat the deeper area for maximal EMS. Would you say that's true, or?
That's 100% true. Yeah, it's always preheating before the EMS, either with trim or tight.
Okay, let's see. Has anyone used tone for high school, university athletes to rehab injuries? Results?
Well, EMS has been used in rehabilitation. As Spiro mentioned, that's kind of where it originated from the rehab space. But we're really talking about a more aesthetic application for it. But there is definitely a functional, core strength value of it as well. We haven't done it on high school athletes.
I think, guys, it's very, very important that if you have a patient that's got an injury, a muscle injury, I think it's important to point out not to use tone on that patient, because when it comes to rehabilitation of muscles, the frequency that you're applying, the protocols that you're using, the daily, I think you're better off having a rehab specialist that's been trained in that, and they use the EMS, you probably heard the term TENS. It's a very different type of treatment and therapy, and the last thing you want is causing either further injury or having complications or problems. So if you have a patient who's injured, muscle injury, you need to send them to the rehab specialist, let the therapist work on EMS in that case. I think that's important. Wouldn't you agree?
Yeah,
Erez?
completely. Yeah, this is a muscle hypertrophy module, not a rehabilitation module.
Okay, let's see what other questions we have. Is Quantificare available on the market? I can answer that one. Yes, it is. And I think that the company is a small company, French company, but certainly working with that sort of camera with you will really help. I totally agree. But we're not mentioning trim. All those treatments with quantificare were without trim. The answer, we're just showing the study, right? So
these are study images. That's right.
so to answer
So
your
right,
question,
we're showing
trim was not part of the
EMS
study.
and tight.
Yeah, trim was not part of the study.
Correct. We have a separate study with trim, but the results are truly all equally impressive, I would say. And we're releasing soon, you know, a lot of the microscopy biopsies and more really objective data. You know, very shortly it's going to be in publication.
Erez, have you ever seen any ulnar nerve activation during triceps treatment? Have you seen that?
Well, first of all, I think it's hard to say. I mean, you're stimulating the muscle. I haven't done, to be honest with you, I have not done triceps with muscle stimulation. Usually I'm focused on the core muscles like the abdomen, obliques. But you would definitely stimulate the triceps muscle, which would you know, extend the arm if you did that.
Right. So a lot of these questions here are from a sport physician. So I'm going to be very, very simple and say that all, as far as it comes to strength training, professional athletes use EMS. It's not something new. But we're going after an aesthetic result. We're not doing strength training, and any injuries should be going to that sports physician or a rehab specialist to address. So in order not to revisit that. Let's see if we have any more questions, Erez. Let's two more. How do you decide tight tone versus tight trim?
Oh, great question. So my personal opinion is that, you know, here, let me show you this slide here. This is how, you know, actually this is Spiro's concept here, and I think it's important. We basically have three different body shapes. We have the, and this is something that's, you know, been in the literature for some time. We have the kind of thin, non-muscular patient. We have kind of the average patient, and then we have the heavy patient right here, ectomorph, endomorph, and mesomorph. And so if you have this patient, and also, by the way, it's important to listen to what the patient wants, you know. You know, this patient may want to have muscle hypertrophy, and they may have some lax skin. So in that case, you're going to use tight and tone. This patient is going to need fat reduction. So you're going to use trim, and, you know, if they have what you think, you know, would be some skin laxity after you remove some fat, then they benefit from tight. To me, the average American patient really needs a combination of tight and trim. Tone is kind of secondary for the average patient because they're not going to see their muscle. Now, they'll feel better core strength, but they won't truly see the aesthetic result of their muscle if they have a large layer of fat there. So I think it's important to kind of target that first. But don't forget, the EMS also reduces fat to some extent synergistically with the tone or with the trim or the tight. So it really depends on the patient how they present to you.
I think it's really critical what Erez just brought out. I mean, these are not ectomorph, endomorph, mesomorph, are sort of, they're very controversial ways of, you know, looking at patients. But, you know, the truth of the matter is it's critical to manage expectations right off the bat. If someone comes in and is, you know, an endomorph and wants a six-pack, I think you first treat with tight and trim, obviously trim and tight and loose skin, and then finally get them to the EMS component. So don't promise what you can deliver. So it's always good to under promise and over deliver. So thank you, Erez. That was a very good point. Erez, the last question is, where do you see this technology going? In other words, there's three elements, right? Have you used this technology on post-lipo patients, for example, that have excess little fat pockets and how, you know, instead of taking them back to the operating room under anesthesia again, how would you treat a post-lipo patient that comes back saying, I want a little more out, or is there any, can you use this machine for that?
Yeah, so actually, you know, what's interesting is first during the trial, we just used it on the, you know, on the typical candidate, the treatment gap group that we discussed. And then as we saw results, we became more comfortable with applying it to other patients, as you said, post-surgical patients. So, you know, Spiro's extremely good at lipo and extremely experienced, but the reality is for people that do liposuction, it's harder than it looks. And to get a really flat, even plane of after liposuction, you know, even the best liposuction technicians get and physicians get some contour deformities or a little lump here. And the problem is to correct that with another lipo can be problematic. You can make it worse. So the radio frequency actually has been a really great modality to remodel that tissue, smooth it out. And I know that many people that do a lot of liposuction have been using, bipolar non-invasive radio frequency for that application.
Would you use this patient with very loose skin on their arms?
Yeah, absolutely. There's so many patients that come with, skin laxity. Brachioplasty is not a good operation. It involves a long incision, and downtime. So for patients with some loose skin on their arms, imagine the 50-year-old, 40-year-old patient plays a lot of tennis. You can pinch that extra skin, drives them crazy. This is a great technology for them. I mean, they're happy to take a 30% improvement and not have any incisions or needle sticks.
Erez, that's a good answer, and I think that's really important, guys. That remember, this is non-invasive. So as it gets worse, you can bring him in and say this is the maximum result you can get. There's a question here. Cool Sculpting claims a 25% change. Our numbers are around 37%, obviously. But I think it's important to outline that you could go down the ladder, right? If you have the non-invasive that can bring them in, but in the event that they need something more, you always have, the body tight, face tight, Morpheus for skin tightening. So the nice thing is now they're part of your ecosystem, but it's critical to make the right diagnosis in the beginning. Otherwise, you're going to have an unhappy patient. So
right, I totally agree with you. A lot of times what I'll do is, like for arms, now that we're on the arm topic, is I'll show them this is a brachioplasty. So consider that to be 100%. And this is a non-invasive skin tightening, the Evolve Tight, and consider that to be 30%. And I'll tell you, a lot of patients, I would say majority of patients, prefer to not have the brachioplasty and take the 30% gladly. And they feel like they got away with something. They came away with a lot of value.
Okay, great. Erez, thank you for taking your time today. Really appreciate it. And
Thank you.
if there's not any more questions, remember, we're happy to say that we had a user meeting back in August where I got, a lot of you guys were upset because we didn't have enough training stuff, and rightfully so. We listened very carefully, and we did a lot of educational series every month, as you know. But we just launched formally InMode University, so that's an educational e-learning center, and everything is on there: webinars, our publications. So it's make sure you go to it, and there's even, you go to InMode's main site, there's a link to it, and you'll find a lot of this stuff over there where you can actually dig deeper. And then again, obviously, if there's any questions, everyone's always available to answer them. But Erez, thanks for taking the time.
Thank you.
Look, I think it's important at the end of the day that we're just the beginning of this, right? Because no one's ever really looked at everything together. And it's funny because as aesthetic surgeons and doctors, I think it's critical to look at everything, and we do that in real time. So not having a machine that can do everything at once all this time is almost like you said, a hammer, and the rest of the world's a nail. So we're excited, but we're only as good as you guys giving us feedback, right? And doing the numbers and coming up with things that you discovered, and that's what makes us stronger, because we're just the beginning of this. But obviously, we are confident enough to know that these results are reflective, and we can certainly apply them down the road to all your patients. But thanks everyone again, and stay safe, and we'll be in touch.
Thank you so much.